Hi, friends. Welcome to another episode of Soaring Through Chaos. And it's always a joy to talk about things that are happening around. Yes, it's been quite a long journey, this pandemic, and along with that, the economic instability and many other challenges. Amid all this, I find amazing initiatives being taken, people going forward, marching forward to create the new normal. And one of the things I noticed was through my friends in Silicon Valley from the San Francisco Bay Area, I got introduced to Dr. Priyanjali Datta. Priyanjali has been doing some very amazing work with the Aaroogya Foundation, and we would hear all about it from her. Priyanjali, tell about you and how you ended up starting the Aaroogya Foundation.
Sure. Thank you, Shankar, for inviting me to your program. And about Aaroogya Foundation, it started really during my college days. And I was doing a lot of co-curricular activities to spread awareness about breast cancer. I also started a fashion society where I called it Bakulam, and I used to raise funds through fashion shows to help the underprivileged women have some treatment. But it really took a serious shape during my final years of school, where my mother was diagnosed with a rare condition called essential thrombocytosis. And the doctor said that there's no other treatment but only and only a lifelong, till whatever day she lives, she has to pop chemotherapy pills. So that's how it pushed me, it gave me a jolt to start Aaroogya Foundation, where I could help more and more women get early detection and get the right treatment at the right time, and not to get compromised due to situations that is not under their hands or control. So that's how I started Aaroogya Foundation. It started
That's
in 2006.
wonderful. Of course, it's challenging to see the suffering of loved ones. It's wonderful how you've taken this initiative to not only be there for your mother, but to be there for millions and millions of women and people in general. And you didn't just stop at doing this work in India. Looks like you're going global. Can you tell us about it and how is it taking shape? How is it that you found my friends in the San Francisco Bay Area?
Sure. To answer your first question about going global, it was always my endeavor to not limit my work to India only. I'm a nature's person, and I believe that the whole world is my home. So I wanted to go to Africa for a long time. Recently, with COVID-19, as a blessing in disguise, I got a grant from the Millennium Alliance, and they chose us as top 16 innovations from India. It's a consortium of USAID, UK government, Facebook, FICCI, and Indian government of Department of Science and Technology. And we are now launching in Tanzania and Rwanda to begin with. So that's how we are going global slowly. Uh, about your friends, I met them last year when I was in the United States and in Bay Area, and I was so lucky to meet Dr. Richard Dasher, uh, who is the director of US Asia Technology Management Center. And through Richard, I met Jeff Chow and Martin Bolsons Petermans. Both Jeff and Martin are advisors. Martin is a board member, and Richard is also a board member. So, very lucky to have met them.
Wonderful, wonderful. And it's not common for people to take these initiatives so early in life. How has it changed your life? You could have been a doctor, super specialized, and but you're doing something slightly different from that. In what ways has it changed you as a person?
As a person, Shankar, what triggered me to do this was really my mother's episode. But I think I was always intending to do a work which was an innovation for people at large since my childhood. So it all start if I trace back to really figure out how did I land up here. My father is the source of motivation and inspiration. He always taught me stories and poems where he told me how great people have done great things without realizing that they are spending their life not for themselves but for others. So I was very inspired by my father. My father was an orphan, and he has seen life in a very different manner. I think he's a man ahead of his time. And he really motivated me to not restrict myself as a girl or as a boy or as an Indian, or he always taught me to be a human being and my religion to be humanity. So that's how I have been shaped since my childhood. And as you see at the background, this is where I grew up in Shillong, Meghalaya, a very less populated place with wonderful, simple, sweet, and kind people. So I think uh, the surrounding imbibed empathy inside me since the very beginning. So that really shaped me as a person. What I went through after I left my home when I was 15 years old, I told my father that I want to do something because you have instigated me to a level where I really want to do and not just imagine that I want to do something for people. So I have to go out of home. And he supported me. My mother was not in favor of sending me away from home, but my father supported me, and I came to New Delhi, which is the capital of India. And for me, New Delhi was completely a different world. And it was completely a cosmopolitan environment, very patriarchal. And I used to look at, whenever I used to walk on roads, I used to look at people and smile. And they used to give me a very weird glance that why is this girl smiling at strangers? And I realized that people are looking at me in a strange way, that why am I smiling? But that was my habit because that's how I grew up. And I have had some really major issues staying alone as a teenager in a city like Delhi. And those things really traumatized me and had put me in depression for over a decade, uh, which combined with my mother's incidents. And also my sister is a special child. She has been undergoing surgeries almost every year since she was 6 months old. So and she is my source of happiness. So she is really my world. um, that or everything, I think, just merged as a strength inside me, which pushed me to come out of my own sorrow and all the time staying in depression. I thought that only medication can't heal me, and I had to do something more. So Aaroogya Foundation gave me that purpose in life, and I'm here today.
Wow, it's hard to even imagine what you must have gone through all this the last decade before you started Arogya. But I'm also glad that you took that impetus and have started this initiative and are doing so much. It reminds me that the theme of our show is soaring through chaos. And we do have a few things in common, including a dad who was an orphan, who was a huge inspiration, even within the limitations, financial and otherwise, and a special needs, in my case, a brother who also is a big inspiration for me. And we have to keep striving. So
Yes.
the normal stereotype of people who get into or start NGOs is that they have access to a lot of money, that
Yes.
or they're well-connected people and so on. Definitely, you don't fit into that. So were
No.
there any unique challenges that you had to go through when you started Arogya? Fundraising is not an easy task. How did you go about all these things?
It was definitely not a smooth road. It was not a cakewalk. I am very, very proud that my father again supported me and my mother both supported me by, they are my first investors. They're my first funders. They supported me in doing something which will never get me profit or earning. And for almost 2 years, I was constantly looking out for people who understood the depth and requirement of the solution. And I went to various government and private institutions, did many programs in 6 states in India. Uh, we got a lot of resources, but we never got funding in the first 2 years. It was only some small donations, and people saw it as a charity. But it took a toll on us, me and my co-founder, Dr. Dhruv Kapkar. It took a toll on us, but we were standing still, standing rigid, and we knew that one day it will take off. Is when Cisco and the Nudge Center for Social Innovation funded us, and they funded top 10 social innovation programs in India. And from there, we started picking up. We also got funding from Millennium Alliance and Schlumberger and a couple of other organizations. And they really saw the need, and especially in times of COVID-19 pandemic, when everyone realized, especially in India, that the foundation of public health is very, very weak and we need to invest there, is when we got a lot of donations. So that is how we have struggled and finally got to this phase.
Really, really amazing to hear this. So the pandemic has changed many things, and among them, the need and awareness for public health. Has
Yes.
your work changed, or has it gotten more deeper in some ways? What have you been doing differently once the pandemic began?
Once the pandemic began, it was a challenge, real life challenge in front of us as a public health organization to respond to an emergency. And we had to respond, being doctors, being a public health organization. We formed a consortium of 23 social and technology organizations like Infosys, Wipro, Boonj, Pratham, and we reached out to 50 plus places in India, almost 200,000 people, with the help of digital healthcare services, including telemedicine and our proprietary artificial intelligence assisted symptom assessment for various diseases. What we saw was definitely happening now, that there will be a dearth of regular essential healthcare services because of the pandemic, as the healthcare infrastructure is overburdened. But with the help of our application, the healthcare worker, the semi-skilled healthcare worker at community level, they could do the screening of basic diseases, just like common cancers of breast, oral, and cervical cancer in women. They could do the screenings along with COVID-19. So for us, I think this was a time of challenge, and we had to quickly respond and innovate as much as we could.
Great. One thing that piqued my interest is that you mentioned AI-based systems for early detection. Having been an AI guy since the 1980s, it's always of
Yeah.
interest to me. And no, I know how complex it is to create something like this. How did you end up, or did you partner with someone? How did you end up creating an AI-based early detection system for various diseases? And what's the state of the art now with you all?
Sure. So it has been quite a journey. It has been my endeavor to work in the space of AI, because I really love the concept. So I did study a few courses, and also my co-founder and I, we joined a few courses together for this. We got a lot of help from Cisco, from Nudge Center for Social Innovation, from their research and AI institutions. we got a lot of help from our mentors who have been in the field of AI. And we have screened 51,000 women in past. So the data really helped us to create initially a rule-based model, but then slowly to evolve into a beta version of machine learning. And now we are improving. So it will keep on improving. The idea is to give access to early detection of cancer in a place where doctor is not present. And through telemedicine, all the time, doctor may or may not be present. So the semi-skilled healthcare worker who is in direct touch with the community, they just fill in a questionnaire. For them, it comes out as a questionnaire, and they get a triaging report of high, moderate, and low risk. So high and moderate are connected to nearby hospital, uh, women who are high and moderate risk, and low risk women are given a prevention of cancer and lifestyle management prescription. And there is an annual screening process. So this is how it is working right now, and we have to keep improving.
This is amazing work. Is it still in beta or is it now available on the app? Can people actually use it?
Yes, people can actually use it now. We still have our doctors in house who make sure that whatever we are sending out is appropriate, because we don't want to uh, mess up with real life decisions. So
Yeah.
we have doctors who are taking each and every decision seriously and scrutinizing before sending it out. But yes, it is very much available in the form of an application.
And as you take it international, especially you talked about taking it to various places in Africa, where the need is
Yeah.
definitely dire. Lack of medical doctors is a problem, even in rural India, the place where I was born. That area hardly has any doctors, so I know very well what the situation is like. But one of the challenges is regionalizing. I mean, people don't always speak English. In many places, they don't, and there are many regional languages. How are you going to deal with these kinds of complexities?
So wherever we launch, we do a customization in local language. For example, in Tanzania, we are now customizing it into their language of Swahili. So similarly, in India, we have customized it in 13 languages, like Hindi, Assamese, Bengali, Marathi, Kannada, Telugu, Tamil, Nepali. So these are the languages, and wherever we launch it with a local partner, because we believe in the strength of collaboration a lot. We can't do this alone in any way. So a local organization really helps us to customize the entire solution, and to also not just do it in terms of technology, but implement it on ground with the help of them. So we do their capacity building. We have a layer of fellowship program. Our fellows stay with them for 6 months on ground, and the local organization picks up with the solution.
Wonderful, wonderful. You're using the terminology used by large NGOs. And how are you able to manage it with, I'm assuming since you're still relatively, what, 5 years or less, right? Since you started
Yes,
this initiative. And the first 2 years it
yes,
was self-funded. So it's only
yes.
been maybe a couple of years that you got funding from both national and international agencies. How are you able to
Yeah.
scale? I mean, how are you able to keep sanity and not work around the clock?
I I would say that I was not so perfect, and I used to work round the clock. But then I realized that this is not going to help me in any way. So I had to put up a schedule and give me a hard stop that, okay, now stop overworking. But this has been quite a journey. This became my entire life. I think I lost touch with my friends. I lost touch with my regular life. I love partying. I didn't do that for 3 years. I love going out and traveling and hiking. I didn't do that for many, many months. But once in a while, I did get some escape to the mountains where I grew up. Uh, and it took me almost, I can safely say 16 to 18 hours a day for the first 2.5 years to work hard. About scale, I remember the class in our incubation by Mr. Sanjay Purohit, who is the chief uh, curating officer of the societal platform, and was an ideating, brainstorming person of the Aadhaar in India, the unique ID. He told us that the problem you're trying to solve is exponentially increasing every day. And to create a solution, you cannot be limited as a on-ground organization. So you need to think from the perspective of a solution that can also scale, maybe not to a level where the problem is increasing by, but at least to a level that you are able to solve 1% of it. And we realize that the problem we are solving is large and huge. 2,000 women in India are getting diagnosed with cancer every day, and every 12 minutes a breast cancer patient is dying. So we were into something really big to solve, and we had to work very hard and make a scalable solution.
Well, I'm so grateful that you got the right kind of support at the right time, and you found your balance. It's easy to get carried away with these things. And do you have any advice for people? Because, especially young people come out with starry eyes, want to do good things, and then what they call, they get jaded with the real world, and it's easy to
Yeah.
give up. I was one of them. When I was your age, I gave up all those idealistic things and got into technology. So technology was a good field, but really I didn't do any other thing except creating great technology in those days. So do you have any suggestions on how people can keep their dreams alive, how they can find the kind of partnerships you have been able to do? Any suggestions?
Sure. I think I'm still at an early stage where I can suggest the right path. But what I would like to share from my experience is that never ever give up on your childhood dreams. Never give up on the beliefs that you have been brought up with. And in adverse situations, never think that this is the end of the road. Hard work has no substitute, but also with the help of the right people, the right mentors, you can do great things. And you have to never hesitate to ask for help. Ask and people will help you. You will find the right people. Um, there are great innovations that has happened in times of disguise like pandemic. And if you ever feel that your dream that you have seen is far-fetched, uh, believe that this is the day, and today if you start working, in X number of days you will achieve something. So never give up.
Oh, thank you. Thank you. In fact, there was a church we used to cross every day when we were working on cancer related medication. The company was FarmQuest. And Seema and I would pass this church, and they had this board, never give up. This was after
Wow.
9/11, 2000, 9/11, 2001, when the
Yeah.
9/11 changed the history of America for a while. And every day we would be like, oh, I'm not sure if I want to continue, and then never give up. So it was a reminder. So thanks again for giving your time to us and sharing your story. And to anybody out there, if you need support, if you need encouragement, please find mentors. There are people who can support you. And we will share Priyanjali's contacts, especially on social media and the work she's doing.
Yeah.
So if anybody wants to partner, if anybody has ideas, or if you want just advice, I'm sure Priyanjali will respond as per her timelines, and I'm also
Sure.
available. And if there's a lot of interest in the work of Aaroogya Foundation or the global partners like Silicon Valley Global Health, we can share more in future. So please stay in touch. And I'm so grateful, Priyanjali, that you are doing this work. And I'm privileged to at least learn about it. And maybe, perhaps, maybe I'll be able to help you when as you go global. And please stay in touch.
Thank Thank you, Shankar. And it's a privilege to talk to you and to be here on Soaring Through Chaos. Thank you so much for this opportunity.
And all the best from all of us here.